An Achilles tendinopathy is more of a degenerative condition of what we call the Achilles tendon, which is the tendon that attaches your calf muscles to the heel bone. With this condition, you can be seen on a continuum where on one stage in the more acute phases, which we might call a reactive tendinopathy, you might get what looks like some swelling, which is actually the thickening of the tissue. And then as things progress and as things start to kind of deteriorate, you might get to the point where you are getting this constant stiffness, this constant discomfort first thing in the morning, and as you get moving, things progress. And in the more chronic cases, you might find that there are actually more long-term changes within the actual structure of the tendon. In the early stages of an Achilles tendinopathy, which we would term more a reactive tendinopathy, you might find there is an initial swelling or even a visible lump to the Achilles, and this we would term a nodule, and it is in fact more of a thickening and kind of chronic overloading of the tendon, and this thickening is more of a protective response of the tendon to try and kind of manage the load. As things progress and become kind of more chronic, you might find you get that real stiffness and soreness first thing in the morning, which gradually eases with running. And then as things continue to progress and worsen, you might find the symptoms actually start to return. And this is when you should start to modify your training. So the causes of an Achilles tendinopathy can first of all come from any mistakes in your training. So this might be a classic too much too soon scenario where you've doubled your mileage. It might also be a sudden kind of incorporation of hills or sprints or strides into your running. But we then must look at the bigger picture, the biomechanics. What's happening at the foot and the ankle? Is there a weakness? Is there a lack of control through the foot on landing? Is there a real stiffness and lack of range to the ankle as you're loading through the foot? And what's the control at the knee and the hip like? Is there a weakness through those outer gluteal muscles that's causing that knee to rotate and drift inwards? That's all feeding in down towards that Achilles and overloading the tendon. The best treatment for an Achilles tendinopathy very much depends on what stage of that continuum you're on. In the early, more acute stages, initially I would maybe recommend a short period of rest. This might only be a few days, just to let things settle and almost put out that fire. In the more severe cases, the physio input might be a bit more robust. We might look at incorporating some shockwave therapy. We might look at kind of heavier loading for the Achilles, and this might be some isometric holds, or this might be some up and down eccentric raises off the edge of a step. Like with any tendinopathy disorder, whether it be an Achilles or a patellar tendon or a gluteal tendon, the key is to listen to the symptoms, and especially those 24-hour symptoms. After your run, is there any soreness immediately after? Is there any stiffness the next morning? As long as those symptoms are progressing and they are not getting any worse, maintain the running, maybe reduce the volume a little, but just manage symptoms. However, if things are more severe, you're finding that stiffness and soreness is deteriorating each time you go out for a run, then we need to modify things a bit more aggressively. With an Achilles tendinopathy, rest is not always best. If you're in and around a 2 or 3 out of 10 on a pain scale and it's just a mild awareness, that's the kind of scenario where I would allow you to continue running. Again, continue to monitor the symptoms. If things don't worsen, brilliant, continue. However, if you feel like that stiffness is worsening or that 2 or 3 is creeping up to a 4, 5 or 6 out of 10, that's the point at which we need to kind of rein in the volume, reduce the intensity and change the running. The best exercises for an Achilles tendinopathy, first of all, depends the location of the injury. If it's more of a mid-portion Achilles tendinopathy, so that's in the mid part of the tendon, the kind of the main body of the tendon, we might initially start with what we call an isometric hold, where you're up on tiptoes, just holding that static position. Then from there, we're progressing things to more the actual up and downs, what we call the eccentric lowers. And again, you're monitoring the symptoms with these exercises. Is there any worsening in that stiffness and that soreness within that 24-hour period? So when it comes to stretching an Achilles tendinopathy, my advice would be to absolutely do not stretch it, whether it be a mid-portion tendinopathy or more of an insertional tendinopathy. Tendons simply do not like stretch. They don't like the tensile stretch, and they don't like that compressive stretch that if you have an Achilles tendinopathy you would suffer from.